For the TigerGraph Hackathon, we chose to tackle mental health because it's one of our largest untreated public health epidemics, and it's something we're really passionate about. Over 400 million people globally aren't getting essential treatment for mental health disorders. Suicide is the leading cause of health among young people. And economically, depression and anxiety are costing $16 trillion in cumulative output loss. With the pandemic, the need for better mental health accessibility is getting even more necessary. For the hackathon, we talked to 10 mental health professionals and learned that the three big problems to solve are finding the right care for patients, reducing the cost of care, and reducing the stigma around getting care. Now, there have been many application-level attempts at solving these, like therapy chatbots or virtual group therapy, but our solution is tackling what we found is the root issue to solve that's upstream of all these approaches, which is getting an accurate, holistic view of a patient to recommend them the right care. We saw this as the perfect application of graph technology to take all factors into account, from the multiple modalities of a person to create a 360 view, and then recommend treatment based on what worked for similar people. So our schema of a patient is taking into account traditional approaches like depression questionnaires, but also social media activity, journal entries, and therapy sessions. Now, we added nodes for factors like sentiment and session attendance, which we're using to calculate similarity scores for patients. Our first challenge was getting the data. There unfortunately aren't many open data sets for mental health, so we took the few base data sets we could find around Twitter sentiment and DAS severity scores and created synthetic data for the hackathon. We know that in production, healthcare organizations would definitely have access to this kind of data and more. Once we developed a 360 view of a patient, we used graph similarity algorithms to recommend the right treatment based on what worked for similar people. Now, this is where we hit our second challenge, which was to create a tweaked Jacquard similarity metric that took into account the number of times someone missed a session or recorded a sad sentiment mood. We were able to overcome these challenges, and we used multiple features of TigerGraph to solve our solution, like creating new queries to find a custom patient journey subgraph, and building that modified Jacquard query to find all similar patients. To show how easily this can be usable by therapists and healthcare organizations, we also used TigerGraph's REST API to create a fully functioning front-end web application. Using our web app that connects to a TigerGraph instance, we can see in a really easy way the patient's 360 view and their journey over time, and we can run our TigerGraph similarity query to get a recommended treatment based on similar patients. To show how this can work from a production standpoint, we also have a create patient view that lets therapists build a view of their patient manually by adding things like voice entries and missed therapy sessions, and then get a recommended treatment in real time by finding all similar patients for a TigerGraph instance. The Patient 360 and similarity solution we made can apply to all levels of mental health accessibility, from giving analytics and EHRs to therapists, powering digital apps for consumers, helping insurance companies understand the mental health of their patient population, and ultimately helping governments get large-scale, accurate view of their population's mental health to create relevant programs to help. We're really excited to continue developing Mental Health Hero. We're currently exploring how to create an even better similarity measure using the node embeddings in the ML workbench at TigerGraph. We've reached out to 3 healthcare organizations to see if they'd be willing to run a pilot with real patient data, and we're asking public officials for feedback to see what it would take to start using Mental Health Hero at a large scale. If you can connect us with any of the above, we'd love your help. We also want to give a huge thank you to the TigerGraph team for helping us with all our TigerGraph questions, especially John Hurt, Dan Barkas, and Parker Erickson.